All right, so welcome everyone to our 2024 Jumpstart. I'm Dr. Rob Van Bergen, but before we get started, we've got some little announcements we need to get through. So first off, it's great to have everyone here. We've done the Jumpstart last year. It was really fun. We got loads of awesome results for people, and it was really awesome to be able to just interact with everyone and see just how there are people out there that are like-minded in being able to actually resolve their own issues and not just jump on the bandwagon, so to speak, of the Western medicine death pit, which we'll get into in a little bit here. So before we get started, this is a huge event. We have thousands of people registered for this. This is always a very big deal for us, and there's a lot of people that we want to make sure we help everyone out. So we're going to make sure everyone is on the same page so that you can get the most out of the Jumpstart course. First, again, for those of you who don't know me, I'm Dr. Rob Van Bergen. I will tell you a little bit about myself in a minute here, but I just wanted to say hi first, so hi. And I'd like to invite you all to introduce yourself as well so that I can get to know you a little better, because we're going to be working together for the next 5 days or so, and there's going to be a lot of stuff that we're going to be covering. So please go ahead and introduce yourself, add hashtag live, hashtag replay, depending on if you're watching live or catching the recording. And I will be checking in the Facebook group as well. And I look forward to meeting all of you virtually that way. Now, we want to make sure you don't miss a thing. So there's going to be a fair bit of people joining throughout the event if my experience from last year is anything to be taken seriously. So expect a little bit of what I would call over communication. Please rest assured, we're going to get through these announcements quite quickly. We just want to kind of make sure that you don't miss anything. So we'll be sending out a daily reminder email and text and an end of day wrap up email as well. It's not like we're trying to spam you or anything of the sort. Just want to make sure that everyone has the resources and access that you need to be able to get through the Jumpstart successfully, okay? Now, my team is on here. They're on Zoom, we're on Facebook, and we're going to fully support you during this event. They have been amazing in putting the event together, making sure everything is set up and ready for success. A special shout out to our team member, Leo. This is Leo's second year with us here. Leo is our workshop concierge and has personally reached out to each of you. Leo is going to help you out in the Facebook group as well as in direct messages on Facebook and text. Now, for those of you who are doing the Jumpstart again with us, I know we got some people here that just wanted to do this all over again. Now, this year, we have made sure to get Leo some help. Last year, we had so much going on, and a lot of people were really worried that we were overworking Leo. So don't hesitate to connect there. Leo has plenty of help for this go around. You're going to be in good hands. If possible, it's really important that you make sure you connect with Leo to get on the text loop with Leo, okay? This is going to get you access to special bonuses, private event invites. These are only available via text, okay? So if you haven't had contact with your concierge yet, drop a need a concierge in the Facebook group or here on the Zoom chat, or you can email concierge@painfreeforlife.com to make sure you get in touch with Leo via text as well. You can also text 415-688-2045. Again, 415-688-2045. Now, nearly done with the announcements. Thanks for hanging on in there, guys. So for the full event experience, I would encourage you to get in the Facebook group. Go to pffljumpstartreplays.com. You can join the group through there, and you can watch the replays on that website as well each day. The big benefit to the Facebook group, and I know a lot of people are not big fans of Facebook. I get that. Personally, I'm not either, but it is a good social platform for us to be able to connect. And what I liked about it last year and what I foresee being a big deal this year as well is being able to interact on the homework. So there's homework here. We're not just gonna teach you stuff and not expect you to be a participant here. Participating is how you work to get well. I get to see your homework questions and interact with you personally as well through the Facebook group. And this was awesome last year because I was able to actually comment on every single person's homework. Took a long time. I'd spend hours doing it each day, but it was well worth it. And really, you're going to get to see more event info there as well. Zoom just isn't really set up to share that. Zoom is great for this actual kind of conference discussion, but for actually interacting, It just doesn't cut it compared to something like that. So if you are going to sign up for the Facebook group, again, I do encourage it, not required, but I do encourage it. Make sure you answer the 3 qualifying questions to get access to the group. If not, my team will be or has been messaging you to ask you those questions. And make sure you accept your friend request from Leo so that he can support you through Messenger as well. Nearly done. Just a few more. Make sure you have your workbook, okay? The workbook is actually there for you to be able to do work with. Check spam. If not, your concierge can help you, or you can download it on the website, pffljumpstartreplays.com. I would ask you please not to share this link, though. It's only for people who registered to attend the event. We don't really want the book just getting passed around all over the place, okay? If you are not able to attend all the sessions live, that's totally okay. Replays will be available until January 31st at 5 p.m. Pacific time. So that's an hour away from now. So add an hour to this, I think, next week. So you can check these out at pffljumpstartreplays.com, and we will send you a link at the end of the day through email. Okay, that's the announcements. So let's dive in for today's session, shall we? I'm just going to share my screen here, so you should all be able to see this presentation I have created for you. Hopefully you can all see that perfectly fine. Okay. All right, so here we are. Pain Free for Life, Jumpstart 2024, Day 1. This is titled by me, The Pain Epidemic. And this is 5 ways conventional medicine has failed you. Oh, it was working. Okay. So again, I'm Dr. Rob Van Bergen. So for those of you who don't know me, and I know we've got about a 50-50 split of people that know me and people that are brand new to this, I'll just introduce myself briefly here. My medical history, as far as what I do and how I do it, my education, I suppose. I attended and completed my bachelor's in holistic health sciences from Quantum University in Hawaii in 2019. And in 2021, I went on to receive my doctorate of natural medicine and my PhD in natural medicine. And I did my dissertation focusing on the benefits of non-invasive microcurrent vagus nerve stimulation for the resolution of inflammation in the body. So there's a little bit of a hint there as to one of the things we'll be talking about this week as well. In 2022, I was honored to be awarded a doctorate in humanitarian services for my work in the field of natural medicine by the World Organization of Natural Medicine. And in 2023, I wrote my Wall Street Journal bestseller, The Hash-8 Protocol for Pain Resolution, which is actually what this course is focused on. And we founded this course based on that book. And I founded the Sana Institute, which is a school for practitioners determined to rid the world of chronic pain and disease. So natural medicine, holistic healing, I believe in it all. What I don't believe in is the conventional medical system, to a degree, okay? I'm not too fanatically radical about it. I do believe there's a time and a place for it, and I will get into that as we go through here. But I want you all to know before we dive in for the week that pain, autoimmune disease, inflammation, chronic disease, it's all like intimately connected. So if you hear me talking about pain, which is what we talk about a fair bit, know that I'm talking about the concept of a healthy body as a whole. And the ability to overcome these things is within the body. No matter what's going on in your body, there's something you can do to improve it. So today we're going to be talking about conventional medicine and some of the major discrepancies that we see in its implementation in our patients. We're going to discuss the underlying truth of the body electric and how the trillions of cells that make up you, as you know yourself, are all connected to the general concept of why we aren't getting better. So what are we going to learn here? So over the course of this week, we will learn all about the methods that you need to employ if you want to become pain-free. We'll look at what isn't working, what has. We're going to identify the root cause of the issue. We're going to discuss the 5 elements of the Hash-8 protocol, and we're going to look to 3 crucial cornerstones in developing what I like to call a pain-free for life mindset. And these are ownership, action, and consistency. I'm going to drill these words into people's heads by the end of this week. I also have some awesome bonus trainings as well that you can check out down the line if you want to learn more about what we do. Of course, we're going to talk about all of these things in further detail as we progress through the Jumpstart. But I want to start here today with the issues with the medical system. And here's the major issue, because we don't have a healthcare system, we have a sick care system. And to start, it's my opinion that conventional medicine does have a time and a place. I have had my life saved from in conventional medicine, and I know other people have as well. For triage, for trauma, it is awesome. And I'm very grateful that we have it. It's there as a last line of defense to deliver treatment to people in need. Yet, despite this, it's kind of being purported as a first line of defense against illness and disease. And we're taught by the system, by society, I suppose, not to worry because we believe that it can fix us, and that the worst case scenarios where we can't be fixed could and will never ever happen to us as individuals. That is, of course, until it does befall us. So the sick care system works in this way. It works first to diagnose you and then to treat the symptoms of that disease. In most cases, totally ignoring what caused that disease in the first place. It focuses on doing what it can to manage the sick, and it actually does very little to help you get well. One example that sticks with me is this idea that I think it was cholesterol. High cholesterol is a problem. And the patient saying to the doctor, well, should I make some changes, exercise? Maybe I should, change my dietary habits. And the doctor turning around and saying, I wouldn't worry about it right now. It's not a big problem at the moment. And when it becomes a problem, there's medications we can give you for that. So that's the kind of mentality that we're working with here. And it applies to almost everything that we work on and do. So covering up the symptoms. So to me, this is the biggest issue with the conventional medical system, right? Medication, surgery, whatever else they throw your way tends to lean towards rapid reactivity to a symptom. So it's not looking to locate a problem, but to put a stop to it, give you a bill, and get you out of the room. This is part of the reason we work with the veterans hospitals in the US. And the reason that they're willing to work with us is because what they want to do is they want to free up beds. They want their goal is to write you a thing, get you out of there, and make a bed for someone else. And it's interesting to work in a system like that, not a system that's looking at preventative healthcare or that's looking at actually dealing with the issue, but something that wants to kind of put a stopper on it and hope it doesn't simmer over later on. So these are some real things that clients have told me, and they're very painful actually to hear. They may seem silly at the moment, but they can be painful to hear when you're on the receiving end of a client that's really devastated by what they believe they are going to have to do. So one thing, a very common thing, is to take these pain meds and you'll live a normal life. Well, we'll get into that in a little bit here. This one, I use this as an example all the time because it still chokes me up, right? You've got early signs of osteoarthritis. So that's a common condition, right? Especially as we get older. I'd like to perform a hip replacement surgery and get ahead of the game. Now, this particular client wasn't experiencing any pain. They weren't experiencing any discomfort. They were actually in there for a checkup for something completely different, and they got diagnosed with osteoarthritis. And in that moment, referred to a surgeon who was thinking, well, okay, let's just get in there and replace that hip now. And there's a huge amount of trauma that happens at that point. It's huge. It absolutely is. So there aren't really any side effects to methotrexate. This was another one. Methotrexate it's kind of used as an anti-rheumatic drug. So what that means is it's there to suppress your immune system. But the original use of methotrexate was as an abortion drug or a cancer drug because it's kind of radioactive. You can't actually, I think you can't touch it and touch something else afterwards without heavily washing your hands. It can actually give radiation poisoning to people if they're in contact with it or with urine from people that have taken methotrexate. So there's a lot of concerns here when a doctor turns around and says there aren't really any side effects to a drug. And this happens a lot too. We'll get to side effects in a minute here. What you eat has little to do with arthritis. Well, that's probably the biggest batch of BS that we've ever heard. Arthritis is inflammation of your joints, and it's intricately connected to what we eat. And how we eat can reverse that. But no, apparently not. If you won't take the medication, no, I won't help you. This one's a really hard one because this does happen a fair bit. People lose their doctors because of things like this. They've gone through these meds, they want off of them, they want a different answer, they want something better, right? But if you won't take the meds, then they don't want anything to do with you. They're done. And they write you off or they strong arm you into taking the medications. Then there's nothing wrong with you. It's all in your head, right? These two things are very common as well. A concept of there's nothing that I can see on my labs or on paper. You must just be making it up. You must just be crazy, right? It's all in your head. And these are things that are absolutely devastating to see from both patients and from a practitioner's perspective. To see people being told that there's nothing wrong with them is a way to make them give up on looking for an answer. And that is a big part of the problem. A lot of the time when people find us, when they start looking into what we can do, they've been through the ringer, they've done it all, right? And they're not really sure anymore what it is that they are supposed to do, what it is that they could do, because they truly believe they've tried it all. So it's devastating that these are the sorts of things that are out there. And this doesn't mean that all conventional medical doctors are bad. I have some very good friends that are conventional medical doctors. There are a lot of people out there that are trying to make a difference, but from the ground up, from the creation of their education path, they were told that they needed to do drugs. The first year textbooks in medical school are sponsored by Purdue in most medical schools. So it's already laying the groundwork to trust the pharmaceutical companies, right? And that is where we fall into this kind of trap. So this concept, this pill will fix you up. This is a familiar concept to many, right? An idea that they'll get better if they just take these pills for a little while. And then a little while turns from weeks to months, months to years, years to decades. And before you know it, the pills aren't working anymore. You need to take more of them. And it's just barely touching it. This is the issue, because as much as people would love to believe, and that we grow up kind of believing that medications can fix whatever ails us, there's unfortunately no such thing as a pill that can resolve disease. All pills are doing is masking the problem and allowing you to degenerate in peace. The pill is actually on the good side of things, lessening the pain and discomfort, right? It's there to improve your life. And as a stopgap, it may work in those short periods of time. On the bad side, what it does is it shortens your lifespan, it numbs your body to the existence of a problem, and it comes with different side effects depending on the drug. And we'll go through some of those in a little bit here. It even impacts your organ function. And this can, in turn, lead to a shortened lifespan and way, way worse. This is a U.S. National Library of Medicine infographic, okay? It's pulled from a pharmaceutical guide itself. And this information talks about potential side effects of these drugs. Now, many people won't even have taken some of these drugs, but there's two on here, three actually, that are extremely common in Western society nowadays. And I just want to look at the side effects of these here. So acetaminophen. So this is your kind of Tylenol style medications, right? Paracetamol, I believe, is acetaminophen as well. That's what they call it in the UK and probably in Australia too. Now, this is a pain reliever and a fever reducer. That's what it's marketed as. And you can go to the grocery store, you can go anywhere, a corner store, and you can buy acetaminophen, right? And it's what we grow up kind of believing we should take when we have pain. It's, you got a headache, let's just take some of that, push it down. But there's an average number of side effects from acetaminophen of 157. It's 157 recorded side effects of acetaminophen, okay? That's not what I see when I go to the store and I look at a bottle and see what's on there. I don't actually really, the one caution is actually about liver, right? So what are some of these side effects? So 9.7% of people that take Tylenol will develop a nervous system disorder So a problem with your nervous system, which is insane that that is even a possibility from something like that that's considered over the counter and safe. You know, insomnia, this can be developed as well as mental disorders, which is nice and loosely classified there. 7.5% of people will develop a mental disorder from taking acetaminophen. Ibuprofen, so this has a higher rate. 43% of people will experience a headache from a nausea. I was looking at the one above it. Nausea from taking ibuprofen. Apnea, that's an issue, right, with sleep. We see increased white blood cell count. So that's not good either, right? Especially in autoimmune compromised people. And who takes NSAIDs, non-steroidal anti-inflammatories? It's a mouthful. Who takes those most often? People that have inflammatory diseases, like autoimmune diseases. And these can increase your white blood cell count, right? And then sertraline is another one. This is a kind of an antidepressant, anti-anxiety one, very commonly prescribed. The side effects of getting off of this drug can be the same as like getting off of meth. People can experience withdrawal, zaps, tics. It can actually shut someone down completely if you're on these things for too long because it alters your brain chemistry. This can cause nausea in 15% of people, headaches in 13% of people, delayed ejaculation apparently in 14% of people. So there are side effects all over the place. And sertraline has 368 recorded side effects, ibuprofen 282 total recorded side effects. Again, you don't see these things, you don't hear about these things as much, right? Gabapentin is a medication that's used to treat pain, nerve pain, in a lot of people. 11% of people that take gabapentin will experience the side effect of pain. So we're dealing with these pills that maybe do one thing, but on the other hand, do way more worse things to us. And many people, in fact, I've never met a single patient that wants to be on medications. Everyone wants to get off of them, right? I mean, the cost alone can be huge, but just being able to get off of them for your livelihood and your body's wellness is absolutely critical. So drugs as a mask, right? People take medications when they feel pain. And this is how I view them. I view them as a mask. These medications, they cover up the pain. It doesn't matter if it's pharmaceutical, if it's marijuana. That's controversial. I know many people believe in that as a viable option. Whatever it may be, to me, it masks the problem, right? It's covering up the pain. It does nothing to fix it. It might make you feel good for now, but really you're just changing out your sad face for your happy face and you're kind of walking about, going about your day. And underneath, the issue is still there. And the longer it's masked, the more damage it can do. It starts to break down the structure of our body, and then the issue turns chronic. So remember what I said earlier, right? There's no such thing as a pill that can resolve disease. Now we're on to surgeries. Surgery is the only option. That's what surgeons believe, and I don't blame them. That's their profession. So it's the way to go, right? But this is becoming a more common and more disturbing go-to solution, not only really for chronic pain, but for any and everything that's going out there, right? It's concept of it hurts, so replace it. It seems like a simple solution. And in an ideal world where there were no complications and you could just teleport a new thing in there and it was a new biological limb, it would probably work out pretty good. But often these surgeries are done unnecessarily early. Remember what I said earlier, the osteoarthritis in the hip. Let's just replace that hip right now. If you ever want to be disturbed by a process, watch a medical procedure where they replace a joint, like a knee or a hip, okay? It's crazy messy, and it's something that, you know, I had to watch for school, but I just can't believe the trauma we put our bodies through in these situations. And in some cases, it may be literally the only option. But the fact that it's purported as the only option throughout, it baffles me still. So sometimes there's really a need, other times there isn't. And I've seen surgeries, unfortunately, go really well and resolve the issue. And other times it's gone wrong and it's made it worse, or at minimum, it's made no change. And now the person is dealing with 6 months recovery time and still experiencing all of the same pain. So surgical complications are a problem as well, right? I believe surgery should be reserved for life-threatening situations. When my appendix burst, I was very glad that they were able to remove that and save my life. right? And there are times when we're like, thank goodness that this is an option. This is a thing that exists. Surgery often brings with it a long recovery time, though, very long, and it leaves you vulnerable to needing more surgeries down the line, creating scar tissue, which brings with it a whole bunch of issues. We're going to talk about that this week as well. Now, the surgery needing more and more surgeries to fix, this is something I see very commonly as well with spinal surgery. People that have had one spinal fusion, and then the next year they need another, and then a couple more. And before you know it, their spine is almost completely fused because everything just keeps leading to more and more issues. So it is something that we definitely need to be cautious about. Now, conventional medicine also ignores the building blocks of a holistic health model, and this is a big problem as well, okay? Mental health, first and foremost, is connected to pain. I don't really care what anyone says about that. I've had enough experience here. My parents, who you'll learn about as we get through this week as well, they've seen it time and time and time again. It's fundamentally important that we acknowledge now and forever that mental health is connected to pain and disease, no matter what we might be told by someone. For some people, it can be a precursor, right? Chronic stress can develop into fibromyalgia or Crohn's disease. For others, chronic pain can develop into a form of PTSD, which can totally shut down the healing process. So it can be both. It can be one thing that triggers the other and vice versa. It's a circle, right? The emotional and the physical walk hand in hand together. Conventional medicine, unfortunately, either ignores the concept here or believes it's not connected at all and that you're just crazy. And again, we've said this already, but this idea that it's all in your head is a little bit of a lie. Are we what we eat? Well, what we put into our body can both harm and heal us. I think most people that show up for these sorts of presentations, they're already aware of this. You're already thinking this, you know it. People who eat clean, organic diets are going to have an easier time healing and preventing disease than those who constantly bog down their body in processed, junky foods. And for fair warning, I pick on pizza and burgers a lot throughout this program. So I apologize if you're big close friends with them. This is because the cells that make up your body are what keeps everything running smoothly within it. And when they are feeding off of imbalanced or poor nutrients, then the cell's going to lose its electrical potential. And it will become almost impossible for it to regenerate at that point. In extreme cases, this can lead to cell death and the development of what we call channelopathies, leading at a minimum to chronic inflammation. I will talk more about channelopathies tomorrow as well. However, aside from with cirrhosis and digestive issues, right, the conventional medical system does not see a connection. The idea, the standard is not allergy testing, right? It's not let's see what you are sensitive to. It's, well, just cut out the burgers, okay? Or just exercise more. It's not this idea that every single thing we put into our bodies defines what our body is, right? My third point, and this one is the one that surprises people the most, is that the body is electric. Conventional medicine might largely ignore this fact, but it can't dispute it. Our cells communicate electrically, so it stands to reason that our body will accept these signals from outside sources as well. In a world in which we didn't evolve, these sources would be the Earth itself, right? The Earth emits an electromagnetic field. The rays of the sun emit electromagnetic fields as well. Natural signals delivered to every cell in our body telling it how to function. Because we did evolve, because we've changed the way the world is and continue to need to somehow adapt to our increasing need for entertainment and connection, we continue to overwhelm the natural environment around us with harmful electromagnetic signals that, simply put, disrupt normal cellular function. If our cells feed off of the radiation of the Earth, and we cover the radiation of the Earth with higher energetic frequencies so that we can download a movie in 10 minutes, then we are overwhelming the cells in that same way. In Europe, this concept is recognized as electromagnetic hypersensitivity. In North America, ask any conventional doctor about this condition, they're probably going to tell you that it's not real, but it's actually a condition in Europe that can get people on disability because it's that debilitating. As an interesting fact, and I honestly cannot remember if I bring this up later or not. So you might, if you go through the whole jump start with me, you might get a bit of a double whammy of information here. But the electric body concept is also further proven by how space stations, so when people go out into outer space, right? These have to have Schumann resonance generators. These are generators that generate electromagnetic fields similar to the Earth's electromagnetic fields. The reason being is that when you get up there, out of the Earth's atmosphere, away from these frequencies, without that, the deterioration of the cells, of the bone, of the tissue is accelerated. And people can actually age faster without exposure to these electromagnetic fields. I do believe we explore that later, but it's interesting because, again, each of these little cells in our body, the trillions of them within it, right, are like little antennas taking in all of that information. And if we ignore that fact, we are ignoring a very big part of how our body communicates. And if we think about communication, this is how the body sends pain signals, creates pain, creates all of these things. So it's something that we really, really want to focus on. And I do. I focus on it a lot. But we'll talk about that a little bit more tomorrow. The conventional medical system is also all about triage, not long-term care. What do I mean here? Well, the medical system is based on an archaic system of triage, not wellness. If you're a soldier and you get shot, you want triage. You want someone to be able to save your life and to deal with that. The system wants to see you in a triage state when you're sick because they're only equipped to handle those phases of conditions, right? You got a cold, well, there's nothing we can do. You have a bacterial infection, well, we can give you an antibiotic for that and it'll fix you right up, right? Or you need a surgery, we can get you in, get you scheduled, get you back out again. These are the issues. They want to go after an active issue, right? Managing symptoms outside of these acute situations is not going to work. And this could be considered fine in that case if the issue will pass in a few weeks, like a cold, right? You could take a decongestant, maybe that'll make you feel a bit better. But if it continues beyond that point, it becomes too challenging to even consider taking it on because they don't have the tools and resources necessary to actually deal with that issue. The risk of side effects from medications goes up the longer the Band-Aid is used, right? The more we use it, the more chances we give our body to reject it and to start reacting to it. So it's not worth it versus the short term, which is kind of where they want to see it. This is also a problem, overspecialization. So over the course of the diagnosis process with someone, you will often get referred to a specialist. This means that when you've achieved a diagnosis, a doctor is likely to say, send you to a rheumatologist or a surgeon, right, general surgeon. And at this point, we're kind of stuck because the specialist will often not be able to look past their own specialization or the diagnosis to kind of see any connection between the body and your wellness and the condition that you're struggling with. And I've seen this firsthand. I've talked about this a lot with people, with patients and stuff before because of this issue. You get caught in a trap, right? You get caught in this trap where you're now stuck with someone that only wants to treat you this one way. Surgical specialists, they're going to want you to do surgery. Rheumatologists, they're going to want to put you on disease-modifying anti-rheumatic drugs. Pain doctors, they're going to want to put you on pain meds. At worst, though less common nowadays, opiates, right? It goes on and on and on. And none of this works on resolving the issue, at least not without creating more in its path. I'll tell you a little story here. I'll talk about my parents more in the next few days. My dad, Dr. Hashe, a few years back, might have been 4 years ago now, actually, it was quite a while ago, was diagnosed with rheumatoid arthritis. And we were treating it, and he wanted to get this diagnosis sort of sorted out because he wasn't sure exactly what was going on. Was it an allergy? Was it rheumatoid arthritis? And they diagnosed him with rheumatoid arthritis. They referred him to a rheumatologist, and he went to see the rheumatologist to see what they would suggest, actually hoping that they would suggest some extra dietary changes and things along those lines. But she wanted to put him on a drug. I think it was methotrexate, actually. And she told him that if he went on methotrexate right now, I think at the time he would have been about 70 years old, he'd get 5 good years. So if he went on the drug, 5 years, no inflammation, no pain, but that would probably be it. After that point, they either wouldn't be able to keep giving him the medications, or his quality of life, he would have broken down too much to be able to continue to function. And he was absolutely baffled. He's been a doctor of natural medicine for a long time, and he couldn't believe that that's what this woman wanted to do. He was like, so I'm going to get 5 years of life, and then I'm done, right? That's essentially it. And she said, that's what you want to, that's, if you were my father, that's what I would want you to do. And he commented, oof, you must really hate your father. And he obviously walked out and very much upset the rheumatologist. And through the Hache protocol, which we're going to be talking about in the coming days, he was able to resolve his rheumatoid arthritis, and he doesn't have any symptoms at all now of that disease. So being able to get through these things, being able to resolve them is possible. But if he had not had his own knowledge, if he'd not had his own confidence to know that there were other options, he might have taken the option they gave him. And that would have been a dangerous, dangerous scenario that you wouldn't really be able to get out of. I mentioned this earlier. Prescription education is what I like to call it. Many doctors go into medical school with the intention of helping people. I don't believe people go in there thinking, haha, I'm going to give them all of the medications that are bad for them. But much of the education itself, and not all, is focused on the medication, so much so that it does become the go-to answer. And the fault is not on that individual doctor, but the system itself. Big Pharma publishes the textbooks that students use, it funds the schools, and it gets in early. It grooms the individual without them even knowing it's happening. So by the time the well-meaning medical student graduates, industry interaction is normal. They've seen them at all of their events, they've talked with reps, they've looked at drugs, they've seen the studies that are done short-term on the medications and what they can achieve. And so they believe, how could they do harm when they do so much good, right? They've come in, they've funded this, they've given sponsorships, they're doing all these studies, so they're good people, right? And there's so many, I don't believe that this is a revelation to many that the prescription industry is a bit of a joke. There's so many documentaries out there now that have exposed a lot of the crimes that people have seen over the years. But it's something that, I still feel an obligation to highlight. And I'm so glad that medical doctors are becoming more aware of it now. My wife actually is a RN, registered nurse, and she had a similar experience in nursing school. But instead of kind of being pushed into the pharmaceuticals early on, she was taught about herbal medicine, diet and nutrition, chiropractors, acupuncture. And she came home from nursing school and she was super excited about it. And she was talking about how they're actually covering all of these things. They even talked about microcurrent. And she was like, wow, this is so cool. I didn't believe the medical system actually would teach us about this stuff. However, as soon as the second year of her 4-year degree started, these ideas were gone. They never got brought up again. It was all pharmacology, pharmacology, pharmacology. And then when she graduated and entered work in a hospital setting, they don't look at any of those things. They have nutritionists, they have physiotherapists, but they don't refer the patients to them. The doctors just write them a script and send them out, right? Just prescriptions, 4 days. We are also more. Conventional medicine might see us as a sack of flesh and blood ready to be poked, prodded, and analyzed until we're finally ready to be deemed lucky enough to become a sack of flesh and blood with a diagnosis. But we need to realize that each of us is made up of trillions of cells, like trillions of these things. And each one of those cells plays a role in our body's functioning. We need to nurture the cells to eliminate the root cause of your pain, improve your body's functioning, and ultimately to restore you to holistic wellness. So let's do a little bit of a recap here. We have sick care and we have what I like to call well care or wellness care. So sick care, this covers up the symptoms as a way of treatment. It exchanges relief or resolution of a symptom for dangerous side effects, and it often ignores the role of the holistic health model. It doesn't see beyond what can be shown in traditional labs, and it ignores individual history that may not seem connected, but is. It's designed to thrive in triage situations, and again, I'm glad that we have it for those. Over-specialize as well, that's a problem. Specialists do not tend to liaise with other specialists. They believe their way, it's their way or the highway, right? So they hyper-focus on their one area of expertise. WellCare, on the other hand, looks to resolve the root, to eradicate the issue. It works on prevention of worsening health. Prevention, right? Let's not get sick in the first place. It recognizes the body as being kind of connected, and it specializes in the body as a whole cohesive system. And it's designed for prevention and resolution of long-term issues. It also realizes that chronic pain and chronic disease is a journey. It's not an overnight event. And this causes us to look at everyone as an individual person. You're going to see this as we progress this week. People are people with names. They're not named after their disease or their condition, right? Everyone has an identity. Everyone has gone through a different experience to reach this point that they're at. And if we don't recognize that, if we don't consider those facts, we're setting the patient up for failure, and we're setting ourselves up for failure as well. Okay, so maybe a lot of information that you already knew about, right? But we're not done yet. We've got lots to go through this week. And for day one, I mentioned already at the beginning, there's homework. I know, right? You may have not had to do homework for years. I get that. I get the feeling. But this is an important part of the process. And it's very important for me as well to start making recommendations throughout this program to see your homework. Again, highly encourage you to get onto the Facebook group. But if not to worry. You can fill in the book on the homework page yourself by typing it, or you can print it out and write it by hand. It's still good to have it. It helps form part of your plan, right? Part of what you're going to be able to do. So I'd like to think a little bit about what we talked about today to reflect on what your healing journey has been like so far, because the goal here is to flip it and change it, right? So in your workbook on page 9, you're going to find a space for you to answer the below questions. And there's 2 questions here, okay? So what have you tried is number 1, okay? What has worked and how much, and kind of what has not worked as well, okay? So we kind of want to know what you've tried, what has worked, what has not worked. The reason being that it's important to reflect. There's lots of different therapies out there. There's medications and stuff like that, sure, there's surgeries, but there's also acupuncture, there's chiropractic, there's massage, there's osteopathy, there's myofascial release. Like, these are all different modalities, and knowing which ones have worked, whether they provide temporary relief, permanent relief, all those things is very helpful in assessing what the underlying root might be. So this is all working up as we work through this program, okay? Remember when I kind of talked about the history of the individual being important, right? This is an important first step. It may not be the most glamorous thing, but we can ascertain a lot from these questions alone. So again, I'm going to sound like a broken record by the end of this about everything anyway, but I'd like to invite everyone once again to post their homework in the Facebook group as well. It's a safe space, totally a private group. I'm sure many people will have excellent suggestions. We have some very talented practitioners and very experienced home users already of the Hache protocol that can probably provide some excellent advice too. And most importantly, it allows me to kind of look in and see your own individual needs as we progress through the jumpstart here. So if you resonated with what I've said today, I'd like to invite you to attend day 2 of our Jumpstart tomorrow, where we're going to be identifying the root source of your pain and what might be aggravating it. This is a big one. This is probably the turning point here, okay? And I can't wait to see you there. I see we got a bunch of people putting their hands up. I get that there's going to be a lot of questions here. A lot of people are going to want to know more, and they're going to want to answer these questions. There are Q&A sessions that we're going to be doing as we progress through the Jumpstart. But the goal is to try and keep these condensed and allow people time to think about these steps as they go through. If you have any questions immediately that need immediate assistance, reach out to your concierge, okay? Leo will be able to help you. And you can do the email, you can do Facebook Messenger, you can do text. All are good options to get assistance, okay? All right. So I'm going to leave it here. You'll see this again, the text Leo number there, 415-688-2045. Make sure to get into the Facebook group if you can. Everyone, it was a pleasure seeing you all here today, and this is just the beginning. We got a long way to go, but we got a lot to cover. But it's really going to be there to make a difference for you, and you're going to love the results that you're able to achieve by just doing this homework and working through the week with me. Okay. I look forward to seeing you tomorrow, same time. Thanks, everyone. Bye-bye.